Good afternoon. Welcome to this poster presentation on a study of anatomy and physiology in virtual reality. My name is Ray Palmer, and I have a Bachelor of Science, and I'm under the mentorship of Dr. Amanda Stead at Pacific University. Our disclosures: I was financially compensated as her graduate assistant, and she is a Pacific University faculty member, as well as is receiving compensation under a 3-year College of Education fellowship to study simulation practices. So clinical simulations have a lot of different forms, and they're a viable education tool that allows communication and science disorder students to acquire professional competencies and skills. Dudding and Nottingham outlined these 5 primary modes of simulation to be used in healthcare training across disciplines. Standardized patients: this is a person who simulates an actual patient in a repeatable and standardized way. Task trainers, which is a device that trains a particular skill. Mannequins, a human-like simulator to mimic human functions. Computer-based simulation, which is a computer-based technology often utilizing gaming technology and augmented reality. And then immersive virtual reality, which is a computer-based 3-dimensional space for immersive learning, and what we're going to be talking about today. So immersive VR is growing in both its popularity and applications as a teaching tool. It broadly refers to a computer-generated 3-dimensional immersive experience that allows the viewer to interact with the environment. A lot of these technologies employed in VR are coming from the world of gaming and have been adapted for virtual healthcare simulations. Most commonly, they are a 360-degree video, also known as immersive or spherical video, and they can be shared for playback on a smartphone, head mounts, or computers such as Google Cardboard, Samsung Gear, and this provides a stereoscopic experience. A study by Kelly and colleagues in 2019 found that their paramedical students in their study had improved knowledge acquisition of cardiovascular anatomy and physiology compared with their performance in non-VR problem-based learning anatomy test. And their qualitative findings showed that students found the equipment manageable and easy to use, and they also reported a high level of satisfaction. So they point to this as a reason to continue to study the area of VR in learning. Another study by Mason and Holmes in 2019 found that students who use VR as a learning tool had a 10% greater improvement in test scores over the use of notes. The researchers state that the participants found benefit in the use of VR, with 71.4% stating that it gave them a clear visual perception of the bones. Their results suggest that VR should be more widely developed to support undergraduate education, and that students want to have it as part of their classroom experience. So based on some early emerging evidence about the beneficial use of VR in learning, it seems important to further investigate VR applications in communication disorders training specifically. So our pilot study, its purpose is to determine if the addition of a virtual reality training component to a typical didactic anatomy and physiology learning results in greater knowledge outcomes for students. And then additionally, we want to investigate to what extent students are interested in this type of modality and their experiences when they use it. So these are our questions. Did the inclusion of a virtual reality component into an A&P module impact learning? And what did students think about the virtual reality component of the study? So this study was approved by the Institutional Review Board at Pacific University, and our sample size included undergrad students at Pacific University, and their eligibility meant that they had to be a current undergrad at Pacific, they had to be 18 years or older, and they had to not have previously taken an anatomy and physiology course specific to communication and science disorders, and they had to have adequate vision to view the task, and they had to have a smartphone. Following their consent, students were added into a Moodle course designed for the study. Moodle is an online learning tool similar to D2L. The course contained a learning module on the respiratory system, including short readings and a video lecture. Following the self-study module, students took a final assessment quiz on their knowledge about the respiratory system specifically. Students who were randomly assigned to the virtual reality group were mailed a Google Cardboard and instructed on how to engage in an additional 15 to 30 minute virtual reality respiration expedition alongside their Moodle module. And so you can see off to the side here on this slide what that looks like in Moodle. And following the expedition, those specific students then took an assessment quiz on knowledge about the respiratory system and an additional Qualtrics survey on their experience using the virtual reality expedition. Here are some pictures. It's really hard to do it justice when it's a two-dimensional photo, but if you can imagine, these images can be moved around. The viewer can get in closer or more far away, and they can click on these little titles at the bottom to get a summary of what its function is within the respiratory system, and they can move in a 360-degree way, looking at different parts of anatomy and physiology. So looking deeper inside the lungs at air exchange at the alveolar level, and then looking down the trachea into the two passages into the lungs. And some other close-up views inside the lungs with air exchange and looking at the microscopic level. So due to COVID-19 and much of academia going online, our participant recruitment has been drastically delayed and is still ongoing. So we don't have enough data to determine if students' learning benefited from the addition of the VR module, but we do have some completed VR module students, and their preliminary results indicate favorability. So we'll discuss those results next. So these are our initial results. So far, the students have contributed that it has strongly influenced their learning, and all students said it was interesting. And we asked students some qualitative questions, and here are their responses so far. So we asked, what was your experience like using the VR expedition? What things about it did you like? What things did you not like? And what positives can you see for the inclusion of VR into student learning? So although this data is ongoing, our literature suggests that using virtual reality as an additional experience to traditional didactic learning can increase student outcomes and enjoyment in the learning process. And we hypothesize that students in the virtual reality group of our pilot will follow a similar pattern of increased knowledge outcomes on assessments, as well as express positive feedback about the use of VR in their experience. And our preliminary evidence on students' engagement with the VR seems to indicate that they enjoyed the VR experience, and they found it both valuable and easy to navigate. It is still unknown if student overall learning outcomes will improve because of the addition, and so these questions still remain. What are the practical implications for including this work into classrooms, and what barriers exist for students benefiting from this teaching tool? So I hope that if you have any questions, you will contact me on my Zoom link. Thank you so much for coming today.